Good afternoon, and thank you so much for joining us. My name is Ebony Caldwell, and I am the System Director for Diversity, Equity, and Inclusion at Rochester Regional Health. And with me, we have Dr. Gary Spink, a psychologist at Rochester Regional Health. October is Mental Health Awareness Month, and today we are discussing the importance of bringing attention to mental health, ending stigmas, and seeking help when you need it. During our discussion, please feel free to post your questions in the comments section and we'll get to as many questions as possible. So let's get started. Dr. Spink, can you tell us why mental health awareness is so important?
Yes, thank you. Mental health awareness is important the same way any sort of health awareness is important. It, Having good mental health can interfere with stuff like things you do throughout your day, whether it's work, being with family, even just leaving your home. We also know that mental health and physical health are very closely connected. So stuff like being in chronic pain and mental health kind of are associated with each other. They influence each other. Uh, so mental health is very much related to everything that happens in our lives. So being more aware of what's going on with yourself, what's going on with the people around you, can help you live a much more fulfilling life.
Great, thank you. And we know that disparities exist in awareness and treatment for mental health. Can you share with us how Rochester Regional Health addresses health disparities in mental health?
Yes. So we have several different ways we kind of are approaching this right now. One is we have several clinics throughout Rochester, both inner city and on suburbs, so that this way we could try and make it easily accessible to lots of people. We're also currently using lots of telehealth, which is another option that COVID kind of brought along, which is great. Insurances are paying for that right now. Fingers crossed it stays that way, which frees it up too. This way you can get at mental health treatment even if you don't have access to like a card to get somewhere. It just gives another option. We also have a bit of it's kind of like a crisis center, behavioral health access and crisis center at St. Mary's, which is open until later hours. I think it closes around 8 o'clock. For people that maybe want to get connected, but they're not sure how to. You go there, you meet with a therapist, you kind of get some more information, and they help to get you connected to one of our clinics that might be best for you, that might be able to fit what you need, as well as location and all those things. Yeah, we have lots of health. We have health people in our EDs to kind of assist if there's a behavioral health concern that shows up there as well.
Right. Great. So it seems like there's a lot of help available. We just need to get people in contact with the right source. So, but we also know that mental health stigma is real and it's deeply rooted, particularly in communities of color. So is there a way to combat mental health stigma to get people the help that they need?
Well, it's a very loaded question. I'll do my best to answer that succinctly. Yes, there are lots of ways to kind of combat that. One is just sort of trying to model for the person, like what is going on, how to best help them get them connected. Um, like you mentioned, people of color. Obviously, I'm not a person of color, but somebody that is a person of color could certainly say, like, I've struggled with this. I've worked with people and kind of discussed their journey to help normalize the experience. Um, that's one way to go about it. Speaking to just somebody that's an important other about your concerns, even if they don't want to speak with you, if they're maybe hooked up with a spiritual advisor or something like that, helping them maybe just speak more about their concerns with somebody else they're closer to, and then maybe they could help bridge that gap to help get them connected to somebody that might be important to them. There is a lot of different stigma out there related to mental health, unfortunately. It's lessening, but people concerned with like how if they're engaged in mental health treatment, it might somehow get to their work, or the police might know about it, or um, their significant other might find out about it, which is all stuff we encounter as mental health providers that we try to help people to work through and understand the protections that are out there. So like HIPAA, for instance. We can't necessarily reveal anything to another party unless we're given consent or there's some sort of emergency or it's someplace where we're mandated to report by law, which typically we go over with patients so they're aware of where these limits fall and everything is confidential after that. I think more and more talking about this is always good, keeping it out there for people to hear. And not only that, like athletes and stuff like that. Like I know that the NFL does have a campaign right now where they're having athletes talk about their journey. I know there was recently the Olympics, like just seeing some more famous people that are struggling with these concerns and how it is something that's part of the human experience is helpful.
Thank you. Normalizing as a part of the human experience. Those are great words for people to adhere to. Again, we want to thank you for joining us. My name is Ebony Caldwell, System Director for Diversity, Equity, and Inclusion, and we are here with Dr. Gary Spink, a psychologist at Rochester Regional, to discuss and promote mental health awareness. And with DEI work, we talk a lot about allies and supporting the work. How can we support mental health awareness and connect people to the appropriate resources?
Well, I think it always starts with a conversation. If you notice something that seems somebody's struggling, whether it's a friend, a family member, if you're a provider, a patient, just speaking with them and saying, hey, I'm noticing this, and getting their viewpoints, talking with them a little bit about what they need, listening to them. A lot of times we jump into fix it mode when we hear a concern and we want to try and fix it for the other person. That's not necessarily what they need. If you aren't able, if you feel like it's beyond what you can handle, trying to help them get connected with somebody else. So whether it's go to your primary care provider, speak with them. Here's a phone number of a good therapist I heard of. Speak with them. Like I said, if you are religious and you have a spiritual advisor, speak with your spiritual advisor, or maybe even just have somebody in your family who's like that go-to person that you come to with all your problems. And just trying to get them speaking about that is always a really, really good first step. And then obviously, as you speak with other people, they're going to have different resources available to them. Like if you speak with your primary care, as an example, they can put in a referral to try and get you set up with our behavioral health program or another therapist elsewhere. There's lots of other support groups available, like NAMI, for instance, has lots of different support groups out there for people that are maybe struggling with mental health. If you're just looking to get around peers and speak to some of these concerns, again, COVID's kind of made it a lot easier if you have access to a smartphone or a computer or something with a camera, because some of that is happening virtually these days. So you don't actually have to leave your house to go speak to somebody. If you're looking for a very easy first step towards this stuff. Yeah.
Great, thank you. So I see there's a question in the chat from M. Maureen Hood. Does Rochester Regional or Rochester General offer DBT to young adults, and is there a long wait list?
All right. Well, that is a very good question. We do have DBT programs for adults here at Rochester General and the Unity side. There's some things that get factored into that, like, for instance, diagnosis. Some insurances will pay for it with certain diagnoses, not with others. So that's something that gets factored into it. And we do have several different clinics, so I can't speak to the wait list on each clinic. Typically, how you would go about getting engaged with a group here is first you would have to go through our intake process, which is 3 visits over 30 days, so we can kind of get some background information. And then once you're engaged with us, then we could set that up as a possible referral. We do have it at our clinics, but I can't give you specifics without knowing a specific clinic and getting information from them to be able to relay it.
Thank you. And so we have a last question that I have, and then we'll go back to the chat and make sure that we've taken any questions there. But we are in the last week of Hispanic Heritage Month, and the 2021 theme is Esperanza, hope. And I'd like to give you an opportunity, Dr. Spink, to leave us with some final words. What makes you hopeful about the future of mental health and well-being?
Well, lots of different things. One, we have a good amount of research going forward right now to try and understand mental health and try to help people better get connected for treatments that work. As one example, we have some research going on in system that we're trying to get off the ground, where we're looking at lots of different factors. We call it biopsychosocial, so biologically, psychologically, and sociologically. And we're working with the clinical systems bio program at RGH to kind of use machine learning to try and see if we could pair people off with a treatment that's likely to be effective. So there's lots of that research going on, which will be helpful for lots of people if we do find some results. Another thing is, like I mentioned, the pushes by athletes to kind of talk about this and celebrities, and then normalize that, I think, is really good, just to kind of help people see that, yes, there was a stigma and the stigma is still there. But it is something that we all experience. It's part of the human experience, anxiety, depression, stuff like that. And seeking out some support when it's needed isn't necessarily something that we should look down upon. It's the same way as if you break your leg, you go and see a doctor to get that fixed. If you're experiencing depression, going and seeing a doctor and getting support that way could be helpful for a lot of, well, it is helpful for a lot of people. Segments such as this, where we talk about these concerns and we talk about the stigma, again, calling it out and telling people how to work around it and ways to approach it, hopefully will take it from the celebrities and make it to normal everyday life. So hopefully families are talking about this with each other, and families are helping to support each other, because family is a big part and friends are a big part of a lot of people's lives.
Great, thank you. So it sounds like talking about mental health, seeking out support, and then having hope for the future is definitely key items to moving forward in our awareness of mental health. Thank you for joining us today. Thank you, Dr. Spinks, for taking the time out of your schedule to talk about mental health awareness. And again, if you're watching, and feel free to leave us questions in the comment section, and we'll be sure to answer them. Thank you again for your time.
Yeah, not a problem.